Hey there, healthcare professionals. Today, I'm diving into something that's been a persistent thorn in our side, MRSA. Methicillin-resistant Staphylococcus aureus, or MRSA, is a type of bacteria that's resistant to many antibiotics, including methicillin, oxacillin, penicillin, and amoxicillin. Let's break it down. MRSA is a strain of Staphylococcus aureus, a common bacterium found on the skin and in the noses of healthy people. While staph bacteria often live harmlessly on our skin, they can cause infections if they enter the body through a cut or wound. MRSA is concerning because it's resistant to many antibiotics used to treat staph infections, making it harder to treat. There are two main types of MRSA infections: hospital-acquired MRSA, or HA-MRSA, and community-acquired MRSA, or K-MRSA. MRSA occurs in medical settings like hospitals and nursing homes, often associated with invasive procedures or devices. This type can be more severe due to the compromised health status of patients. K-MRSA occurs in the wider community outside of healthcare settings. It often presents as skin infections like boils or abscesses and can affect otherwise healthy individuals. So, what are the symptoms of MRSA infections? They can vary depending on the site of infection. Common symptoms include red, swollen, painful bumps on the skin that may be filled with pus. These can resemble spider bites or boils and may be warm to the touch. If MRSA enters the bloodstream, lungs, urinary tract, or surgical sites, it can cause more severe symptoms like fever, chills, shortness of breath, and chest pain. Several factors can increase the risk of acquiring MRSA. These include hospitalization, especially prolonged stays or in intensive care units, the use of invasive devices like catheters or breathing tubes, living in crowded or unsanitary conditions such as prisons, military barracks, and dormitories, participating in contact sports, and having a weakened immune system due to conditions like HIV/AIDS, cancer treatments, or other chronic illnesses. Some real-world examples of MRSA infections include a high school wrestler developing a painful red boil on his arm that's diagnosed as MRSA after failing to respond to standard antibiotics, a patient in a hospital developing a bloodstream infection after surgery that's identified as MRSA, and an elderly patient in a nursing home developing pneumonia after being on a ventilator, with MRSA complicating the treatment. Preventing MRSA infections is crucial, and it involves several strategies. Regular and thorough hand washing is a must in both healthcare settings and the community. Healthcare providers should use gloves and gowns when caring for patients with MRSA. Regular cleaning of surfaces and equipment in hospitals and other settings is essential. Proper wound care, keeping cuts and scrapes clean and covered until healed, and avoiding sharing personal items like towels, razors, and clothing are also key. Treating MRSA infections can be challenging due to antibiotic resistance. The choice of antibiotics depends on the type and severity of the infection and the susceptibility profile of the MRSA strain. Commonly used antibiotics include vancomycin, linezolid, and daptomycin. In some cases, surgical intervention may be required to drain abscesses or remove infected tissue. In conclusion, MRSA is a significant public health concern due to its resistance to multiple antibiotics and its ability to cause severe infections. Understanding the risk factors, symptoms, prevention strategies, and treatment options is essential for managing and controlling the spread of MRSA. Regular hand hygiene, proper wound care, and prudent antibiotic use are critical components in the fight against MRSA. Thanks for watching, and stay